My name is Babu Mohan. I work with the Department of Internal Medicine, University of Arizona, Banner University Medical Center, Tucson, Arizona. On behalf of my co-authors, Dr. Saurabh Chandan with Gastroenterology, University of Nebraska Medical Center, Omaha, Nebraska, Dr. Shahab Khan, who works as a research volunteer with me, Dr. Lena Kasab, Internal Medicine, Mayo Clinic, Rochester, Dr. Susrit Trakuru, Internal Medicine, Cleveland Clinic Foundation, Dr. Suresh Ponada, Internal Medicine, Roanoke Carilion Clinic, Dr. Ravishankar Ashok Kumar, Department of Gastroenterology, Singapore General Hospital, and our senior author, Dr. Douglas Adler, Gastroenterology and Hepatology from University of Utah, Salt Lake City. We thank you all for watching this author interview video for Endoscopy Journal on our study, The Efficacy and Safety of Endoscopic Ultrasound-Guided Treatment of Gastric Varices, a systematic review and meta-analysis with direct endoscopic glue injection as a comparator. Gastric varices can be catastrophic when they bleed, with an estimated 1-year mortality of over 50%. Medical treatment include a combination of fluid resuscitation, medications to reduce portal pressure, etc. Endoscopic options include injection of direct endoscopic glue for bleeding gastric varices. Recently, a lot of studies have evaluated the efficacy of endoscopic ultrasound guided treatment modalities in the treatment of gastric varices. The aim of this meta-analysis was to provide a robust data on endoscopic ultrasound guided treatment modalities for bleeding gastric varices. In this meta-analysis, we included studies that reported on the use of endoscopic ultrasound guidance in treatment of bleeding or recently bled gastric varices. We included studies that used glue, coil, or a combination of glue and coil together. In order to put the results in perspective to direct endoscopic therapy, we included studies that reported on the treatment of gastric varices by direct endoscopic glue injection, and we used its pooled rates as a non-causal comparator. Outcomes assessed were the pooled rate of gastric varices treatment efficacy, gastric varices obliteration, gastric varices recurrence, and gastric varices rebleeding, early and late. In addition, we also evaluated the adverse events, distal organ embolism, all-cause mortality, and mortality due to gastric varices bleed. In the final analysis, we had 23 studies that reported on 851 patients undergoing endoscopic ultrasound-guided therapy. 12 cohorts were treated with a combination of glue and coil. 9 cohorts underwent glue therapy only. 3 cohorts had coil only, all of them under EUS guidance. For the comparator group, we had a total of 28 studies that reported on 3,461 patients who were treated with direct endoscopic glue therapy. The pool rate of treatment efficacy with the EUS-guided treatment for gastric varices was 93.7%, and it seemed comparable to direct endoscopic therapy, which was 91.4%. However, the pool rate of gastric varices obliteration with EUS was 84.4%, and with direct endoscopic glue injection was 62.6%. EUS guidance seemed to be superior based on a non-causal method of comparison. Pool rate of gastric varices recurrence was 9% with EUS compared to 18% with direct endoscopic glue injection. The pooled rate of early rebleeding with EUS was 7% as compared to 5% with direct endoscopic glue injection. Pooled rate of late rebleeding was 11.6% with EUS, and with direct endoscopic glue injection, it was a 17%. We did a subgroup analysis of the various modalities of EUS-guided treatment, and we found that EUS, coil, and glue, a combination of coil and glue, seemed to demonstrate significantly fewer events of gastric varices recurrence compared to the other modalities. In conclusion, EUS-guided therapy of gastric varices demonstrates treatment efficacy in 94% of patients as compared to 91% of patients undergoing direct endoscopic glue injection therapy. EUS-guided therapy seems to result in more percentage of patients demonstrating gastric varices obliteration and less percentage of patients having a gastric varices recurrence when compared to direct endoscopic glue injection therapy. Among the EUS-guided modalities of treatment, coil with glue seems to be the best modality. Of course, our methods of comparison is non-causal, and that's a very important limitation of this study. I thank you all for taking your time to watch this video.